It's a great pleasure to be here. And you wonder what a pediatric radiologist that sits all day in front of a workstation is doing about global pediatric imaging. We'll see during this presentation. The other topic that's the main reason why I'm here today is that we are celebrating the International Day of Radiology. That's usually done on November 8th because that's the day that Röntgen was born. And so the European Society of Radiology selected this day several years ago to pay tribute to the advances of imaging. So they had a book on the history of radiology, then on neuroradiology, on chest radiology, and this year they dedicated the year for pediatric imaging, and more specifically this week. Many activities were developed for this week, and you can see them on the website of the World Federation of Pediatric Imaging. One of the main activities that was developed was getting together a group of writers from all over the world to write a book on pediatric imaging. It's called The Gentle Way. And if you are interested, you can download it free from the website and use it show it to your patients or to entertain yourselves with that. It's really entertaining, trust me. And as you can see, some of the other activities that were done, there's many videos that were placed on the website and they're on Facebook. And one of the pediatric radiologists in Oakland was showing her kid that it's never too early to start learning the pictures. And I thought it was really cute. There is a website called Radiopedia that is commonly used by the pediatric radiologists and radiology trainees overall. And we placed 22 imaging cases in there. And in the first 2 days, we got 130,000 people checking in and participating in the case discussions. So they are on the website, and you can download the pediatric playlist and see some very interesting cases in there. So what is the role of pediatric imaging in global health? As you know, pediatric imaging plays a very important role in the diagnosis, management, and follow-up of diseases. And this is true both in high and low resource settings. Having worked in both places, I worked in Brazil for several years before coming here, and I've been here at UCLA for almost 35 years. I sometimes felt I was more helpful in Brazil, where the resources were limited and the knowledge made so much more different. But I also get tremendous satisfaction working with all of you here at UCLA and now extending our activities globally with our colleagues in Mozambique. How did pediatric radiology came to exist? It was actually not a specialty that evolved from radiology itself, but it was practicing pediatricians that thought this was really interesting. These images do show fractures, they show pneumonia, and they started investigating, and then the subspecialty of pediatric radiology came up. And as this specialty evolved, even subspecialties of pediatric radiology came to exist, like pediatric neuroradiology, pediatric interventional radiology, and so forth. Pediatric imaging is one of 3 subspecialties of radiology that are recognized by the American Board of Radiology. That's neuroradiology, IR, and Peds. So looking back to the chronology of pediatric imaging developed, the X-rays were discovered in 1895. In 1945, Dr. Geffen published the first book on pediatric imaging. And in 1958, the Society of Pediatric Radiology was found here in the United States, followed in 1963 by the European Society, and then we got the Latin American Society, the Asian Society. A couple of years ago, the African Society was formed. And working with these colleagues from all over the world, as you can see from the flags below, we formed the World Federation of Pediatric Imaging. That is an international organization that was launched at the International Pediatric Radiology meeting in 2011 in London and has evolved into a political and medical organization governed by an international board. And its global mission is to unite the pediatric organizations to have one voice, a common message, and a unified network addressing the global challenges of pediatric imaging. What we found is that some societies were developing tools and materials and information, and then another society was trying to do the same thing. And so we figure if we get together, the right hand will know what the left hand is doing, and we'll get things better solved. Also, representation in front of international organizations like the World Health Organization would be better achieved if we were as one group. So the primary goal of this organization was communication collaboration between the pediatric imaging practitioners via their organization. So there's not a person that is a member of this organization, it's the societies. And to date, we have not only the international societies, but many of local societies like the German, the French, the Argentinian, the South African, the Nigerian societies as national and supranational organizations. So how do we communicate among ourselves? Being an international society, we mostly rely on our website. And that's what I would like to refer you to, which is the World Federation Pediatric Imaging Web.org. And it's a site that has information about the entity itself, about organization, outreach, child imaging safety events that are taking place around the world. We communicate between ourselves through newsletters, through articles that are published in the Journal of Pediatric Radiology, through Facebook and Twitter. I have to confess that's for a younger generation than mine, but it works. And we also have the old-fashioned in-person meetings, which are a challenge to organize since you would have to get together people from all over the world. And we do manage to do that by people that are attending international meetings and people that attend by web communications. What is our work context? As you know, diagnostic imaging services in the modern medical settings have evolved tremendously. And even state-of-the-art healthcare can overlook the unique needs of children. Here at UCLA, we have an example that we have fantastic units, major equipment, but a kid gets very frightened when they get into those so impersonal rooms. So trying to make this more child-friendly is one of the major targets that we have. Dedicated pediatric imaging training is simply out of reach for most of the lower resource nations, which already confront multiple challenges. So if we can help them in any way to achieve some progress and better treat their children, that's a great thing to do. So the other goals that we developed was advocating appropriate practices and resource allocation for children. And for example, the adequate CT doses for children is one of those. Education, which is fundamental, you don't get anywhere if people are not properly educated. Patient safety, particularly in radiation safety and protection. There's no sense in giving children doses of adult patients without being careful about the long-term consequences of that. Outreach, education, and training in lower resource settings, and research. Advocacy is one of major terms of the organization, and we work in multiple regions trying to get pediatric input into the clinical topic at hand. So we got together with the International Society of Radiology, and we have a site just for pediatrics focusing on issues that are unique to that patient population, like the pediatric TB, for example. We work with World Health Organization in their campaigns about pneumonia, vaccination, which ways that imaging can contribute for that, and also on the radiation safety issues. I'm repeating the issue of radiation safety because that's fundamental in children. CT scans were developed back in 1970s, and they rapidly evolved from one machine that took 5 minutes to get one slice, which was what we had at Children's in Boston back in the 1970s, to machines that will do an exam in seconds. It takes longer to place the patient on the machine than to do the actual study. And then there's the possibility of doing the study on the arterial phase, on the venous phase, on the delayed phase, and that is widely used in the adult population. So here you have an example of what was happening when they did in a small child using an adult dose. They did the pre-contrast, the early phase, the late phase, and the delayed phase, and the kid got a total of 18.7 millisieverts. That was the equivalent of approximately 1,000 chest x-rays. That's for one study, and kids are likely to get more than one study in their lifetime. So it really became a major issue that we had to focus on reducing these doses and make this adapted for children. So that's how the whole issue of the Image Gently campaign came up to exist, was a lead from the Society of Pediatric Radiology, and other organizations followed, and there are 32 international and national societies that have got involved with that and has had major success. And so successful that even the adult radiology formed the Image Wisely campaign because they realized there was overuse of imaging in adults as well. So the idea of our association with the Image Gently is that we expand their international committee and we avoid duplication of resources and make sure that the kids get better care. So you see in the terms of advocacy for the international child safety, we have been everywhere trying to advocate for that. We've been to Africa, to South America, to Asia, Japan, and always trying to bring this message of image safely, imaging save kids, is expose them to radiation, but it gives tremendous importance. And so that is one of the major regions in which we are developing. So what about the child imaging safety in lower resource settings? It's very impressive. I was speaking to radiologists in the Philippines, and he told me that the companies have saturated the American and European markets, and now they went to Asia, and they're selling CT scans all over the place, and they are not necessarily implementing those pediatric doses. So they really asked for assistance because there is so much of that being done in Asia. And other initiatives similar to the Image Gently were developed for Africa and for Latin America, and we are working with them in those regards. And we really have to address what are the needs of a specific site and partner to provide what is the information that they need, not the one that we think they need. So education through cross-regional groups is being done through YouTube. You have a video library that is formed a steering committee that decides what goes in there. We have 8 videos, and you're welcome to download them and go through some very interesting material. There's the web content that I encourage you to check, and the case of the week that goes on the World Federation website. We also, in modern settings, advertise the meetings that are done at different places. And for example, in Brazil, they have a monthly conference on pediatric imaging that I have encouraged our colleagues in Mozambique to log in and participate in the communication, because these lectures are in Portuguese. And the Mozambicans know the Brazilian accent because they watch the Brazilian soap operas. And so the Congress in Chile was very successful, and there will be one coming up in Chicago next May that will be another international meeting, and many of the conferences will be transmitted live through web seminars to people attending from different parts of the world. A challenge is the coordination of timing there. So we also have worked in low resource settings, and one of the major issues is the brain drain. You bring someone from a low resource country to train here, and they may be getting so fascinated by the resource they don't want it to come back. So one of our colleagues that works at Children's Hospital in Philadelphia developed a whole curriculum for diagnostic radiology and a pediatric radiology fellowship that takes place in Addis Ababa, and an international faculty goes there to teach. So there have been 5 pediatric radiology courses in Ethiopia over the past 5 years, and they have been extremely successful. So we think that's a model to be followed. And this is the educational channel through the YouTube. We have those launched this year, and they have been downloaded more than 5,000 times. The most popular one is Introduction to Chest Imaging by my colleague Dr. Taylor from Harvard, and you can imagine that's the study we do the most. So understandably, people want to know more about that. But we really have had sentinel efforts in outreach, education, and training in low-resource settings. Why would it be that? Because in our own setting, we had the idea that we were a tool to communicate between the pediatric radiologists through the imaging organizations. So why did we get so centered in lower resource settings? When you see that 2/3 of the world population lack adequate access to imaging resources, and quantifying the lack of access to radiology is difficult because of the complexity in measuring medical personnel, the hardware available, quality of the product available, and other components of radiological services. But we know that shortages are estimated to affect 3.5 to 4.7 billion people. That's a lot of people. And where are the children? So if we go and check population-wise where the children are, the majority of them are located in countries with very low resources. And you see there Africa and Asia are very high numbers. Central America, South America. And then where do the kids die? And you see the majority of deaths are also located in Africa and Asia. So clearly we are drawn into these areas that have so much suffering. And you know better than a pediatric imager what are the 6 conditions that are responsible for about 70% of the children's deaths: acute respiratory infections, mostly pneumonia, diarrhea, malaria, measles, HIV and AIDS, and the proportion of contribution of HIV and AIDS to the total mortality in children under 5, especially in sub-Saharan Africa, is increasing, and the neonatal conditions like prematurity, birth asphyxia, and infections. So you see that imaging has a role to play in most of these conditions. If we zoom on tuberculosis that affects so many children, that is a tremendous burden, and with about 64 deaths per year, you recognize that TB in children may be difficult to diagnose. In many cases, it will be the chest X-ray that will be helpful to make the diagnosis and the follow-up of tuberculosis in children. Now, what about the equipment availability? So most countries in Africa will report that they have 1 CT per 1 million inhabitants. And a country like Denmark will tell you that they have 24 CTs per 1 million inhabitants. Most of the African countries say they have 1 MRI scanner for the whole country, and in Denmark they have 14 units for 1 million inhabitants. And this equipment differential ratio between the developed and developing countries is similar to the reported differences in medical personnel. So for example, in Africa, they report they have 1 physician for every 5,000 people, while here in the United States, we have 1 physician for every 350 people. And even when we report that we have the equipment and the physician, that does not necessarily mean that that equipment is being placed to good use. If you see this slide, that's a hospital in Haiti, which after the earthquake got poured resources in. And what you see there is a CT scan that's sitting outside of the hospital, getting oxidized outside in the weather because there was no place to install it, no one that knew how to do it, so the whole machine went to waste. And I have seen this happen in more than one place in the world. So where do we start with a challenge so big? So fundamental is to do the education in the lower resource settings. So we figured that the best way would be to bolt on to the existing proven educational projects. And that's why the example of Ethiopia was so good. And that's why, for example, we are working with the Department of Pediatrics here to work with the pediatricians in Mozambique. Now, what is that we have to always think of? We have to bear in mind that the objectives of training have to be targeted to the specific needs of the local facility and its personnel. And we should include the technical aspects of image acquisition, image interpretation, but also how we're going to do the maintenance and repair of the devices. I have seen equipment being donated, then it breaks and no one knows how to fix it and the machine is not used anymore. How to do the workflow of those patients. In Mozambique, the pediatric patients are in one hospital, the imaging facility is in somewhere else, and they have to go to a gurney there. The resource management, safety, and utilization criteria. So this is a slide when I went to Mozambique last year, and the desire to learn was so big. It was just truly amazing. And that's my colleague Dorothy Bullis doing an ultrasound training in Haiti. We also have to remember that the training healthcare personnel in the developed work to work in underserved areas is equally important and is always is frequently overlooked. So it's kind of unfair to think that someone that's prepared to work in a high technology area, high resource, is ready to go work in a low resource area. So we have to really get the knowledge and skills to see how we're going to go work in that specific circumstance. And overlooking these needs is frequently the cause of failure of very many well-intentioned projects. So the education is accomplished not only by going there and teaching them, but also by education that is accompanied by a push for educational content. So I was in Mozambique for a week, but then a pediatrician came here for 2 months to learn about how to interpret the films, how the CTs are done, and so forth. And more important, also make those issues available on the internet. That will be a much cheaper way to achieve the information. So the issues of pediatric tuberculosis and how to interpret the findings on plain films are in videos and in lectures. And these tools that we have developed were tested on use. Here's a website on the International Radiology Society. And how do we harness the technological innovation, which is paramount on the international reach? These novel technologies can improve quality, they may optimize connectivity, and decrease the cost of services. And examples of technology innovation include imaging services and educational platforms used to support the personnel. So here we have another map that provides the information of what are the percentage of internet users around the world. So you see that a lot of places have access to the internet, but the places that have most disease, the low resource, the people that we are trying to reach, look at Africa, they don't have that much connectivity to the internet. And when they do, the services frequently are very slow and get easily overwhelmed when we try to transmit images. So what is leading us is the use of the cell phones. That's the great leveler, because 6 billion people have access to mobile phones, while only 4.5 billion have access to toilets that work. And that's a report from the United Nations. 1 billion people have mobile phones in China and India, and Africa is home to twice as many mobile phones as the United States. So developing countries accounted for 80% of new mobile subscriptions in 2011, with the number of internet users doubling at a 4-year period. So how can we get the information transmitted through the telephone is the challenge now, and it's being very successfully achieved. So how do we do the communication and collaboration through cross-regional groups, through outreach? We have Dr. Cicero Silva from Yale being the leader of the group. And here you see a list of places that we have worked at in Asia, in Africa, in Latin America. And these are very dedicated people that have a real passion and motivation to work. So Telereading is one of the things that comes to mind, and we have associated ourselves with the Doctors Without Borders. And we started slowly. In 2013, we had approximately 120 reads for 3 readers, and in 2014, one reading only got 113 cases to read. So that is really increasing in number. So Dr. Savas Andronico, which is one of the readers for the MSF, in January to May of 2015, he read 40 cases. In June to December 2014, he had read 5 cases. And most of the cases were for tuberculosis, and more recently, he was looking at spine films for trauma and abdominal radiographs for free air. And we have other readers from all over the world, some that have joined MSF to work with them. We think that there's a big potential because they have multi-country access to vast HIV cohorts. They offer an NGO interface that can overcome Ministry of Health infrastructure and financial and other issues. They have undergoing an internal boost, and the results are to be ascertained. So they are really getting more and more adept to the use of the reading of films and going from the plain films, as you see here, getting them to digital images that can be transferred through the phone. And we started to do work in Cambodia that has started slowly, but we get opinions transmitted to them frequently in 24 hours or less. So Savas has really spearheaded a movement to promote ultrasound for lower resource settings. Here, if we say that a pediatrician is going to be doing ultrasound, you're going to get some cross looks from the pediatric radiologist. What do you think you're going to be doing the head ultrasound by yourself? You don't know how to hold a transducer and so forth. And so, but you have the pediatric radiologist here to come and do the study with you. There will be countries that have no radiologists whatsoever. So if they have access to an ultrasound that doesn't have radiation and can provide information with the very few steps, that will be really a major help for the low resource settings. And so we are developing this under the umbrella of the World Federation. And in order to do so, we are participating on the Doctors Without Borders book of how to do things. And so we have developed texts on how to do a hip ultrasound, how to do an ultrasound of the chest, looking for pneumonia, how to do ultrasound of the bones to look for fractures and abscesses, and also to do mediastinal ultrasound as a proxy, looking for tuberculosis, looking for lymph nodes. And we had placed this in action. So we had pediatric radiologists participate in a group called Imaging the World, and Julie Hurtaud was our fellow here many years ago. She now practices in Canada. She went to Africa last year with Sabine Bellar, and she was thrilled to be able to work in Uganda and show them how to do the imaging, train the physicians and the nurses that were there on how to do the ultrasound, and see the enthusiasm and how helpful that was for the patients. We have physicians going to other parts of the world, in Nigeria, in Latin America, and their response is that of great enthusiasm, that this is an empowering tool. And then we have research being developed. So this idea of doing lymph nodes in the mediastinum for tuberculosis, we started to do a study in South Africa where we get ultrasounds, MRIs, and the pathology results to see whether that is really a useful tool or not. And so we are using this. This is one of our fellows going to Cape Town to teach them, the nurse, how to do the ultrasound. And now we're going to be comparing the results and writing a paper about that. This is one of the images that show the usefulness of ultrasound. Kid comes with a radiopaque chest, mediastinal heart is deviated. Then they did an ultrasound, and there was a small fluid collection at the bottom, but there was a much larger fluid collection laterally. And then they placed the chest tube, and they took the tremendous amount of pus that was located there. And we also plan to reinvigorate the tuberculosis work via the TB Corner and keep building partnerships with individuals, with organizations and institutions, connecting the left hand with the right, and so to harness opportunities, both on and inject pediatric imaging expertise into imaging outreach initiatives whenever possible. So we have worked very hard to create a clear mandate to govern driving forward regional groups that are highly diverse. And we really were so happy to see moments of tangible worldwide collaboration. We recognize there are many challenges ahead, particularly in the lower resource settings, but the achievements have made us really proud. We have had the financial support of the two major societies of pediatric radiology, but financing is what is the really crucial point to keep you going. And there is so much more ahead that needs to be done, but it can be done. And now that you have become aware of the pediatric radiologists that have this desire to work with you, that you have been going to different countries, developing different projects, think of us when you go there, and we'll go along. And I would again like to thank you very much for the opportunity to speak here, and I'm open for questions and comments you may have. Thank you.